Now, let's talk about COVID-19. The Ashanti Regional Health Service is warning the country risks a second wave of a coronavirus outbreak if Ghanaians do not observe the COVID-19 protocols. The region currently has a cumulative case record of 11,017 active cases and a daily infection of 2. But Regional Director of Health, Dr. Emmanuel Tinkran, says the public needs to stick to the protocols to ensure the rate of infections remain low. Speaking at a stakeholders meeting on the maintenance phase of COVID-19 in Kumasi, Dr. Tinkran called on political leaders to educate their supporters to observe the protocols, especially during the electioneering campaign season. Love FM's Erastus Sasaredonko has more.
The COVID-19 regional stakeholders meeting was to take stock of the fight against the virus and propose new ways of sustaining the fight. The stakeholders also deliberated on ways of getting members of the public who have stopped visiting health facilities due to the fear of COVID to start doing so. Regional Director of Health, Dr. Emmanuel Tinkran, says continuous abstention from seeking general health care will contribute to more deaths outside the realm of COVID.
COVID is killing people. It can kill people directly. That is direct COVID death. And it can kill people indirectly because it deprives them of certain health. It deprives them of certain resources. And people will die out of that. So you realize that if we calculate the number of COVID deaths in this country, it's maybe about 300. But indirectly, COVID has killed more people than that. Those people who with hypertension and other diseases who were supposed to have gone to hospital, but for the fear of COVID, they couldn't go. When you die, though you've died from hypertension, but it's COVID, still COVID related. Because if not for COVID, you'd have survived. The protocols...
Despite the low level of COVID cases at the moment, he said any form of complacency in observing the protocols could trigger a second wave of infections.
The only reason why we are not getting the morbidity and then the mortality is because of the strategies that we've put in place. And everybody is working at it. But if we leave out this strategy and think that without the strategy you can just go about and do a normal thing, and COVID will still remain as low as 2 maybe per week in Ashanti region, then we are lying. Because it's only one case that you need to escalate the number of cases that you have. So once we are getting 1 or 2 cases, if we are not careful and then we don't adhere to the protocols, the possibility that the cases will come up is also very rare.
Political leaders have been drawing crowds that do not observe the COVID-19 protocols in the election season. The Regional Director of Health, Dr. Tinkran, had a message for them.
The danger we have is that we have overcrowding because people are going around doing campaigns and then people are following them. But one thing I've noticed is that you can see that most of the leaders will be wearing their face mask, will try and then observe the social distancing, most probably the hand hygiene protocol. But those who are following them are not adhering to the protocol. So the challenge is that here it calls for leadership. So the leaders should be bold enough to tell their followers that COVID is still around. So let's make sure that what I'm doing, you follow my example. You can come to the Deba ground, you can do everything, but always make sure that you put on your face mask and then observe the social distancing.
Reporting for JoyNews, Erastus Sasaredonko, Kumasi.